mating season and foaling are some of the busiest times and most rewarding for thoroughbred breeders. Join us as we go behind the scenes in a number of stud farms to learn all about the foaling process, from preparing to foal, assisting and aftercare.
Hi, I'm Clare Manning. I am the owner and manager of Boherguy stud on the Clare in County Kildare. And during the months of January to June here, we are quite busy with the foaling season. We have boarding mares, our own mares, and then we take in some mares for clients to foal and leave again. So we have a variety of things going on for the 6 months. So prior to a mare foaling, we generally bring them in and they will be stabled on shavings generally, and then when it gets closer to the time, we will move into this barn here, which is what we call our maternity unit. So in here we have some smaller boxes and then we have some large foaling boxes. So generally they come in, there's cameras in all the stables, so we can watch them, and as they progress they will move into a foaling box. All the boxes in here are heavily bedded down with straw, and then when they get closer to the time they will get alarms stitched into their vulvas, and again everything is on cameras 24/7 for us to keep an eye on them. So the hygiene is of the utmost importance here, especially with so many mares coming in and foaling. So each box the whole barn is completely disinfected and power washed out after the yearling and the foal prep. And then as each mare comes in, the box is heavily bedded with straw. They are mucked out 7 days a week for the whole season. Once a mare has foaled, that box is completely stripped down to the ground. That box will be power washed, disinfected, fogged, and then fresh straw will be put back in. So everything is completely clean for the next mare coming into foal. So generally when they come in, I just leave them be. They get a bit of a tidy up, we pull their manes or whatever, but we leave them be because they're going out during the day into mucky fields to roll and whatever. Once the mare has foaled, I then wash down her udder to make sure it's clean before the foal latches on. But prior to them actually foaling, I just leave them in their natural way and just try not to interfere too much. You know, they're getting very heavy close to foaling and they don't really want to be messed with. So we have gloves, both the long and the short. The gloves I use, so as soon as the mare breaks water, I will put on a long glove and check the presentation of the foal. We have a tail bandage with a long glove, so I put the tail bandage on the tail or the glove on the tail and wrap the tail bandage around it to keep everything out of the way, and so I have a good view of what's going on. I have a scissors for a variety of different reasons, especially if you have a red bag. We have some twine to tie up the placenta so it's not dangling off the mare's legs, especially the maiden mares. We have some cotton wool and Hibby scrub here that we can make up to clean off the mare's bag and udder before the foal latches on. We've a refractometer, which allows us to test the mare's colostrum. If it's not over 27%, it's supplemented with frozen colostrum. I have a colostrum bank here. We have iodine, which goes on the foal's navel once the umbilical cord breaks. All our foals receive 5 cc's of depisilin, just as a little backup until their immunity kicks in. I have a towel for my own hands, a lead rope to put on any mare if she's not standing quiet, more so for the maidens. We also have a big towel to dry off the foals when they're born, and a bucket that the placenta goes in, so we can put that aside and if the vet needs to check it or anything. So basically this allows me to strip the mare without using my hand, and I generally give the foals one bottle of milk, somewhere between 150 to 200 mils before they stand, of the mare's own milk, or also if it's frozen colostrum. And that I just find helps them to be a bit stronger and probably latch on a little bit quicker. So that's the essence of what we need on a regular foaling. Of course, if you have something a bit out of the ordinary, you might need to grab something else, but that is your day-to-day normal foaling kit. So typical signs that a mare is going to foal. In the days prior, I find that they are a little bit more agitated. Maybe you go in and they're not as friendly, they might pin their ears back. What I do notice is a pattern of maybe a week prior to them foaling that they do a little box walking as if they're going to foal, and I often think that's the foal getting into position, so similar to Braxton Hicks in women. And then you'll often see they might go quiet for maybe 5 to 7 days. And then within the hours prior to foaling, or even maybe 24 hours, they start to do a little bit more box walking. Their tail is slightly elevated. They swish their tail more. Then as it gets closer, you'll see them box walking more often, pawing the ground up and down more frequently. And they're your typical signs. Some mares show very little signs. Some mares could do this for even up to 18, 24 hours prior to foaling. Maidens tend to be a lot more dramatic because they don't know what's going on. They're feeling the pain, they're feeling pressure, and they really have no idea what's happening to them. So every mare is different, but there is kind of a pattern all the same. So much closer to the time, so we'll say within the prior half an hour to hour, they're definitely box walking, pawing, getting down, their breathing is heavier, they may start sweating up, lying flat out, and all those things, they're just very agitated and uncomfortable on a whole. And that is probably your time to really keep an eye on them and that you are getting close. So other signs are before you get to any of that, so we'll say a month prior to them foaling, you want to be checking your mare's bags every day. So to check that the milk is coming into the udder. I find a lot of times that mares in the morning will have big bags. Maybe they go out for exercise and they come back in and the bag has gone down. So that indicates that they're not quite there yet. It's when the milk is staying in the bag and the bag is staying quite big that you're getting closer. Then mares will start to wax up and maybe drip milk. Not all mares do this. Some mares do it 1 year, maybe not the next year. Maidens tend not to have as big a bag and mightn't show any waxing or running milk. So they're the ones you really have to be careful of. So once the mare's waters break, I generally go in with my long glove, insert my hand and make sure that the foal is presented correctly. So you want your 2 front feet slightly forward, slightly back, followed by your nose. That is your ideal position. If you have that, I generally tie up the tail and leave the mare get to it. Most mares will foal unassisted, do it all themselves. With the maiden mares or a big foal in a smaller mare, I tend maybe to hold one leg and not actually pull, but just as the contractions are coming, to stop the mare sucking it back in without actually pulling or putting any pressure, and they generally foal themselves fairly quickly. So within, suppose, 10 to 20 minutes post-breaking water, you 9 times out of 10 will have a foal on the ground if everything goes smoothly. Once the foal is born, then I clamp the umbilical cord. I start taking the fluid out of the foal's nose, clearing out its nose, and I give the foal a rub to stimulate him with a towel. Hopefully the mare stays lying down. It makes life a lot easier for us. And then once they're a few minutes old and kind of everything is okay, I then will give them the enema, the depisilin, and at that point then you're going to just leave them kind of bond with the mother. And once the umbilical cord is broken, you put your iodine then on your foal's navel. There can be many different complications when you're foaling, and they're not all completely simple. When they are, it's very straightforward and everything goes very smoothly. It makes my life easy. You can have things like a red bag, for argument's sake. So usually when the water breaks, you see a white amniotic sac. In this case, it'll be red, but you also have to make sure that that is a red bag and not a bladder. So you do that by checking that you can actually feel a nose or a hoof with inside this velvety red bag. If that is the case, you need to cut it straight away without cutting the foal inside, and then you need to get that foal out as quick as you can as it's oxygen deprived. I find on doing that you do end up with dummy foals sometimes, and foals that need a little extra assistance. The odd time you do have a mare when you cut the red bag that they also will help you and just push the foal out, and you mightn't have to intervene as much as necessary. You can also have a dystocia, so that's when the foal is not coming in your nose diving position. They can come upside down with the feet going up. You can have a nose on one leg back, 2 legs back, all sorts of things. When you get into things like that, it's all about timing. So you will try and maybe get the mare to walk and stop pushing, and she'll often be able to correct it itself, especially if they're upside down. Sometimes you might have to reach in and try and pull a head back and pull a leg forward. But kind of when you are getting to a point where you don't feel you're making any progress, that's when you probably need to call a vet, and 9 times out of 10 they'll tell you to just bring it straight into the clinic, just for a bit of extra assistance. So once the foal is born, you've obviously looked after its navel, etc., but it doesn't stop there. For the hours preceding, you want to make sure that the mare's colostrum is up to scratch, and that if it's not, that the foal gets extra supplemental colostrum of a high quality. This can be bottle fed or stomach tubed. You also want to make sure that the foal is latching on and is getting a good suck. A foal that's going over and having a little suck and kind of playing with the mare's bag isn't really getting the nutrition and the milk it needs, so that you want to see them sucking for a long period of time and getting down and having long sleeps is the ideal scenario there, and that the mare does have enough milk. If she doesn't, you can help by giving her some otilium tablets, and that helps to bring on the milk supply. I find it very handy with your maiden mares. In your hours afterwards, again, that the foal is able to get up and down unassisted, that it's able to go to the mare's bag, latch on itself, and is doing everything as it should. Following on from that, so probably the next morning, 12 hours post-foaling, you're going to be taking a blood off the mare to run your IgG, which is your immunoglobulin, and that'll help indicate the foal's immunity. If this isn't up to scratch, you may stomach tube the foal with extra colostrum or give it plasma and then retake the IgG, and that'll help keep out infection and give the foal immunity. You're also looking to make sure that the foal is just behaving normally, that it's not lethargic or down, that everything is going the way you'd expect it to in a newborn. So once the foal is born, I generally heat up our enema, which helps to deliver the meconium, which is the foal's first poo. So what I do is put some lukewarm water in something like this, a tub or a jar, and sit your enema into it so it's warm. And then once the liquid inside is warmed up, it's not going to be as much of a shock when you insert it into a foal's anus. You take off the orange bit, you put it in, squeeze the liquid into the foal, and that helps to deliver the meconium. So we give these routinely. Colts generally find it harder to pass their meconium than fillies, as a rule of thumb. Not everything is the same. And once that meconium has passed, then the foal has a feeling that it's going to be a little bit more hungry because all of the poo is out of it. So once that has passed, I generally give them 5 or 10 minutes and will then give them their first bottle, which will be the first bit of nutrition they'll get in the outside world. So as soon as the mare has foaled, literally straight away, I'd always check the mare's gums and kind of just pay close attention to her, that she's breathing. Of course, it's going to be slightly elevated, but that she's not breathing too heavily, that her gums haven't gone pale, and that there's a sign maybe she's hemorrhaging. Afterwards, her vulva is going to be a little bit swollen, so you're not going to pay too much attention to that straight away. But probably the following morning, have a look at her vulva, check that there's no unusual discharge. If your placenta has been okay and has passed normally within 3 hours of foaling, everything should be smoothly. If you didn't have a placenta that's of good quality or slightly off colour and there was discharge, of course you're going to get your vet, you're going to flush her. If a mare has torn, you're going to get your vet to have a look and make sure that there's nothing they can do then and there. Usually it's so swollen that you have to leave it for a few days before you can intervene. And overall, that the mare isn't lying down too much. Of course she's going to lie down a little bit more and be tired, but that she is kind of bouncing back to her normal self, that her bag isn't so small that the foal is completely draining her. And of course the nutrition is a big thing. So once the mare's foal here, we give everything a bran mash, which is a scoop of bran mixed in with some sweet feed. It's nice and warm and it's full of fibre to help everything get going again and get their guts moving. And after that, you want to make sure that the mare is getting plenty of nutrition, be it through hay and through your hard feed. She's not just looking after herself now, she also has a foal to supply milk for. And if it's a big foal, especially colts, they can be quite taxing on the mare. So if they're not getting adequate nutrition, they're not going to be able to look after themselves and a foal. And when you get them back in foal, essentially they're looking after 3 people. So obviously when a mare is pregnant, the foal is quite big and it squishes everything up further. So their stomach isn't as big. They haven't got as much room to take in what they normally would. And once they foal, everything shifts back. And that can cause them a little bit of discomfort and pain. So you'll often see mares, they'll get down and they'll be a little bit uncomfortable, showing signs similar to colic of pawing and rolling a bit post-foaling. This can also happen when they're waiting for the placenta to pass and they're having contractions again for that to pass. You are verging on the line of keeping an eye that it is just everything moving back in, and that usually comes within a couple of hours, of foaling. But anything after that, or if they're getting very vigorous in their rolling, you obviously don't want them rolling from side to side, that they could potentially twist a gut. Getting them up and getting them walking is great. I try and get them out for a little run in the sand arena, you know, within 10, 12 hours of foaling, even just for 10 minutes. It just gets the mares moving, helps to flush out everything out of their vulva and kind of allow everything to settle back down. But if you found that they were still getting pretty agitated and getting worse, like colic signs, you'd want to call your vet, and they'll probably be able to give them some pain relief and Buscopan, and that usually does the trick.